Good afternoon. My name is Rhonda Haynes. I want to thank everybody for attending my Capstone Senior Project presentation. Today we're going to be looking at retaining nurses in the emergency department. As we know, an emergency department is very overcrowded now. We're seeing an influx of patients coming through the emergency department, never having enough room to put the patients in, as these pictures show. Our nurses are working in a fast-paced environment under very stressful conditions. As you see, I've got the picture there saying, "I'm a little stressed, leave if you want to be okay with it." Our nurses are feeling the pressure. We're short-staffed and they're starting to feel the pressure there. Recruiting and retaining nurses in the emergency department, along with the current nursing shortage that we are facing, has been difficult for many hospitals. Many hospitals are struggling when you combine the stress, the long hours, the short staffing, the frustration of nurses. Many nurses are leaving the emergency department, so we need to take a look at what we can do to retain those nurses in the emergency department. What we're looking at in the emergency department, we're facing a shortage of registered nurses. We are having trouble recruiting and retaining new registered nurses, our new graduates, and we're losing our seasoned nurses. They are moving on to other specialties, so we need to take a look at why this is happening. So in the shortage of registered nurses, let's take a look at the aging nurses. Our baby boomers, which is a lot of our nurses, are starting to get toward retirement. They're not wanting to stay in that fast-paced, stressful environment, so they're moving on to other areas of practice, and many of them are getting ready to retire. In this stage, what we're also looking at is a need for more registered nurses. Not only are they retiring, but we're looking at a large part of our population that are aging and are needing more medical attention. We're seeing them with higher levels of medical needs that are not being met, and they're all coming to the emergency room. So we're seeing an influx of patients coming into the emergency room. Not only are we short nurses now, but looking into the future, we're going to need more nurses. We're looking at the complexity of care is changing. We're using different clinical interventions. We're also looking at different technologies, and a lot of your seasoned nurses are not wanting to go through all of this training, going over to our electronic records, all the new technologies and interventions. Many of them are moving away from that. We are also looking at a decrease in faculty and our educators. Not that many nurses are going on to further their education to become educators, therefore we're looking at less students being accepted into programs, therefore we're graduating less nurses. So we are not growing the number of nurses that we are graduating as fast as our needs are growing, especially in the hospital setting. Also, nurses today are feeling like they are not well respected. They feel like they have lack of support from their superiors, and this has been a major issue within nurses in all areas. Okay, looking at recruiting and retaining. We're looking at our new graduate nurses coming into the emergency department, and a problem that we're having there is inadequate training. They are coming out of an area that they are having education within a confined area, that's in a controlled area that they feel comfortable with, and then we're putting them into an area without a lot of support and continued education, where you're looking at having to use your critical thinking skills, you're having to prioritize, there's a lot of stress, you're pushing a lot of patients through the emergency department, and so they have a lack of confidence that's coming from not receiving continued education. We're doing short-term orientations and really not providing the support to these new graduate nurses that we need to. They're having an inability to meet the patient needs. That's lack of experience. That comes with experience. That comes with partnering with a preceptor and a mentor, an educator, and providing that they need to know. The stress is affecting, and the long shifts are affecting these new nurses, not only new nurses, but seasoned nurses that are new to the emergency department. You're looking at most nurses are still working 12-hour shifts. Because of the shortage, they're working more than their 3 shifts per week, so they are stressed, they are tired. That's when we come into some issues with the confidence level. They feel like they're not appreciated for that extra effort that they are giving. And again, lack of respect from their superiors. A lot of your nurses also are going and continuing their education and becoming mid-level providers. Some are going into the education field, which we definitely need, but a lot of them are becoming providers. Therefore, we're losing these nurses in the emergency departments and in hospitals. Okay, let's take a look at the big picture. It's estimated that by 2020, that the nursing shortage will increase within the United States to 800,000 nurses that we are going to be short. Now we're going to have a lot of travel nurses that will fill some of these positions and different things that are going to be costly to hospitals, but we are still going to be short with the growth that they're expecting with the number of patients that will be presenting to the emergency departments and admitted within the hospitals. We are not going to be able to meet the needs of these patients. When we look at our nursing supervisors and executives, only 10% of them feel confident in new nurse graduates that are coming into emergency departments in the hospital setting. They really don't have the confidence that they are prepared and for the safety and to effectively treat these patients. Well, what are we doing about that? We can say that they don't feel like these nurses are prepared, but what are we doing to help prepare them and to adequately train them to be successful in the hospitals and in the critical care aspect? Turnover rates. When we're looking at new graduate nurses, we have a large turnover rate, and a lot of that becomes evident because they're not getting the support or the additional training that they need. During the first year after graduation, your new graduate nurses, approximately 30% of them are leaving the hospital setting, not just the emergency department, but the hospital setting. During the second year, we're looking at 57% that are leaving. So on top of already having a shortage of nurses, we've got to do something to figure out how to maintain the nurses within the hospital setting. Okay. So currently, what are we doing currently in the hospitals? Most of your hospitals are still looking at a 3-phase orientation program, which is definitely not working. One day is a general hospital orientation. Normally you're looking at 3 to 5 days that are spent in an orientation setting that's a nursing orientation. And then most of your new nurses, not just new graduate nurses, but that are new to the Department of Emergency Medicine, are looking at a 6 to 12 week orientation period clinically where they're placed with a preceptor. We're looking at, especially new graduate nurses, coming from a structured environment, then going into this wide open, high pressure environment where they're using their critical thinking skills, their clinical skills, a lot of pressure on them, a lot of stress, and it's so fast paced, and we're expecting them in this 6 to 12 weeks of a clinical orientation with a preceptor to come out and know their skills and be on top of it and be able to face these nurse-patient ratios that we're seeing in most emergency departments. This will put a nurse into a position where they are lacking confidence. They're lacking their confidence, and a lot of them are wondering why they became nurses and wanting to leave the program. We've got to look at what we can do to support them. So what effect does a shortage of competent trained nurses have on patient care in the emergency department? Well, we've already talked about the fact that we're seeing more and more patients in the emergency department, but we don't have the nurses to meet the needs of those patients. We've got longer wait times. So with longer wait times, these patients, especially the ones that are seriously ill, are not getting seen and taken care of in adequate times. So are we taking care of our patients with quality care? No, we are not. Patients are leaving the emergency department without being seen. That's another risk that we're taking, because we could think somebody's coming in and they've got a headache, and it could be something so much more serious than just a headache or a migraine. We're letting these patients leave, and because of lack of staff and lack of nurses that are highly trained that are in the triage areas of hospitals, and being so burdened that they're not able to go back and check on these patients, we are losing patients and we are risking the care of these patients. So that's something that we definitely need to look at. So basically the issues that we are facing here is, no, we are not providing safe patient care. We are not providing quality care to our patients. Are the patients satisfied? Well, of course they're not, and we've got to look at what we can do, because it first comes with having the adequate staffing, having properly trained staff to take care of these patients. Therefore, we will see better outcomes and better satisfaction with these patients. Okay, what effect does it have on our staff members in the hospital as a whole, as far as not being able to retain nurses and the shortage of nurses? Well, we've got some overworked staff. They're stressed, they're overworked, and they're heading toward burnout. This is not a good thing. The morale of the staff is decreasing, something that we need to be concerned about. We also know that if you've got a tired, stressed nurse, what that can equal errors in taking care of a patient, medication administration errors, different types of errors which causes patient harm. When you look at that, we're talking about dollars. We're concerned about the care of the patient and the quality care of the patient, but the hospital is losing dollars. Harm to a patient is going to equal a lawsuit, which is costly. Losing patients, they're walking out of the emergency department. Not only are we not taking proper care of our patients, but the hospital's losing dollars. if patients are not satisfied with the care we are providing, if we are not providing quality care, our reimbursement drops. So all of this is hitting the bottom line of the hospital. We're also being affected by losing the staff. Then we have to go out and we have to recruit. We have to bring in costly temporary staff. We have to recruit staff. We have to train them. That is all costly to the hospital. Those are all things that we need to take a look at. Here's just some examples. You know, you've got a stressed, tired, frustrated nurse. That can equal errors, which equals harm to our patient, and we're looking at patient mortality. We're looking at lawsuits. We're not just looking at a financial loss, but we're looking at not taking care of our patients. I thought this was really good because this could be an experienced nurse, but a medication error. You know, this nurse has pulled up insulin to give to a patient. Everything is accurate. They're ready to go ahead and administer. They're called away to a phone call. They come back, well, everything's great, so what do? Rush in the room to administer. We've forgotten our 5 rights, the patient rights that we should check. Well, it was administered, but to the wrong patient. So we have not accurately treated one patient and provided quality care. We've done harm to another patient. So those are things that we've really got to be concerned about. We've got overcrowded waiting rooms, and we do not have the personnel that's accurately trained or enough personnel to go back and reassess these patients. They should be reassessed every hour. This is not happening. You hear stories all the time of how patients have died in waiting rooms. This is why. So we've got to answer the question on why can we not recruit and retain nurses in the emergency department, and what do we need to do to be able to retain them. Okay, I'm looking at some of the research that's been done, and Friedman, Cooper, Clegg, and Fitzpatrick have looked at the impact of putting new graduate nurses into an orientation or fellowship program that can last up to a year, and did this improve the retention rate, and did it also improve the bottom line for hospitals? Yes, the year-long orientation process, specializing in critical care nurses, has impacted positively the nursing retention, the bottom line of the hospital. What we're also seeing is improved quality of care and safety for our patients. We're seeing a lessening of medication errors. We're taking better care of our patients. We're moving them through the emergency department at a faster rate, getting them taken care of, getting them treated and discharged, or getting them admitted. We're taking better care of our patients by doing that. So what do we need to do? So let's look at an implementation of a structured orientation and fellowship program. So education utilizing a critical care curriculum. Just because nurses are out of school or they're seasoned nurses that are new to the emergency department doesn't mean it stops there and we can get these nurses in and hit the floor running. What we need to do is utilize class time to make sure these nurses are trained. We also need to look at professional role development. A lot of your seasoned nurses are leaving because they've been in a zone. They don't feel like they have a voice. They're not being heard. We need to put them into committees, make them preceptors, give them a voice to be heard. They can help make a difference in these processes and improve the retention of the new nurses that we're seeing. Also, we need to look at using simulation as a learning strategy. Repetitiveness, simulation, by trial and error, that's how nurses learn. And so that's something that needs to be put into that. We need to look at our experienced nurses, putting them in place as preceptors, like I said, and working with not only new graduate nurses, but nurses that are new to the emergency department, new to critical care medicine. We need to have bi-weekly meetings that are held between our orientees, the preceptors, and our managers. We need to be approachable. We need to know what's going right and what we need to improve on. Hospital educator needs to be available to provide education on a regular basis, not just once a year competencies, but we need to ensure that all staff, your seasoned staff, that your new staff, everyone in that emergency department is properly trained to provide care to our patients. Also, we need to put in place a mentoring program. We need to have a mentor for these nurses that they feel comfortable going to and talking about their frustrations. Someone that they can just have a voice with that will listen to them so that they will feel better, and we have seen that this is proven to reduce the frustration. Outcomes of the implementation strategies. Again, we've got a lot of research that is showing that by putting in a fellowship program, a structured orientation and fellowship program, it's improving retention rates, it's increasing employee satisfaction. And we know when we've got enough adequate staffing, they are trained, and they are satisfied with their job, and they are working as a team, in turn that's going to take care of our patients. We are going to improve the quality of care of our patients. We're going to have better outcomes with our patients and improve that patient satisfaction, which again is going to hit that bottom dollar as far as improving the financial aspect of the hospital. Okay, there was a hospital that I did a little bit of research on. They're in Honolulu, Hawaii. They were losing, during the first year of having orientation of nurses, of new graduate nurses, 55.97% was all that they were retaining. So they were losing almost half of their nurses. So what they wanted to do is look at a process they could put in place. What would it take to retain these nurses? So basically they did a nursing fellowship program. They also trained clinical coaches, and they had a nurse manager academy. So their nurses that were seasoned, that were tending to leave there because of frustration, they gave them an opportunity to move up, to learn more, to become a voice there. And what their outcomes by doing this, basically they were looking at the objectives of improving their patient care, their safety, their outcomes, of retaining more nurses, of having better trained nurses, of seeing better outcomes and higher patient satisfaction. The development of experienced nurses in the clinical coaching resulted in a decrease in their turnover rate. Those nurses were happier. Your seasoned nurses were not walking out because they were so frustrated. They had an improvement in communication skills when dealing with conflicts within the department. Again, this came from some roundtable settings and working with their nurses and giving them opportunities to have a voice and speak. They handled conflict better, not just within the personnel, but patient complaints. They had a successful professional development staff. They increased their employee satisfaction and retention rates, and thereby they increased their satisfaction rates. They had better outcomes with their patients. So let's look at, in conclusion, critical staffing shortages combined with the low retention rates of nurses within hospitals has negatively impacted patient quality of care, patient safety, and patient outcomes. Research supports the introduction of fellowship programs into hospitals by providing adequate training and support, along with pairing new nurses with mentors. There has been an increase in retention rates and employee satisfaction. The hospital that I'm currently affiliated with has just finished their first group of fellowship new graduate nurses coming through. They did a year-long program, placing them with preceptors, having regular meetings. They had mentors, and they have seen an increase. They were losing about 22% of their new transferring in nurses combined with new graduate nurses. This past year with the fellowship program, their loss of nurses was less than 5%. So we know this type program works. So what do we need to do? We need to take a look at what we're doing and implementing these programs and providing the support, becoming a team and working together, and that's all going to provide us with better patient outcomes and better care. Thank you, everyone. I appreciate it.